Good morning. This is Dr. Tarek. Today I am going to discuss, in short or in brief, ventricle arrhythmias. Ventricle arrhythmias, I will touch three types: ventricular tachycardia, ventricle flutter, and ventricle fibrillation. In ventricle, a focus start firing impulses or producing electric impulses at a rate of 101 to 250 beats impulses per minute that cause this many beats per minute. The ventricle contracts very fast, and the ECG that is produced look like this one. The QRS complexes are big, bizarre, and wide. They are very wide, occupying a lot of space, so there is no space for P wave to appear. So P wave is absent. As P wave is absent, so PR interval cannot be detected. So you will see this ECG on ventricular tachycardia. Heart rate will be 101 to 250 beat per minute. QRS complex is wide. P wave absent. PR interval cannot be detected. This is how the ventricular tachycardia will look like. Bizarre wide ventricle complexes. Then is next is ventricle flutter. The heart rate ventricle is contracting faster than tachycardia, and the QRS complexes are produced which are narrow, peaked, and the heart rate is 250 to 350 per minute. It could be 400. Ventricle flutter, the as I told you, heart rate to 53 to 350. QRS complexes are peaked, narrow, and there is no P wave. As there is no P wave, so PR interval cannot be detected. So this will be the picture of the ventricular flutter. This is ventricular tachycardia and ventricular flutter together. Tachycardia 101 to 250 and ventricular flutter 250 to 350. They will be wide, bizarre, and they will be narrow and peaked. Then is ventricular fibrillation. Both can complicate into ventricular fibrillation. Now, what happens in ventricular fibrillation? There are multiple foci that are producing electricity in the ventricles, right and left ventricle both, and they are trying to take the control of the heartbeat. But they cannot make one contraction of the ventricles. So little areas of the ventricle on both side, right and vent, they are contracting independently. So they produce small and large complexes like this. They are neither QR complexes, they are nor P waves. All the areas are independently producing some depolarization in very small area that cannot cause contraction of the whole ventricle. So they can cause quivering of the heart only. So there will be this irregular type of ECG. The heart rate will be 400 to 600. And P wave will be absent. QRS is also absent. Both are absent. No QRS, no P wave. Of course, when there is no P wave, PR interval cannot be calculated. So this will be the picture of the ventricular fibrillation. This is a lethal sign, dangerous sign. So whenever the medical assistant or ECG technician find these ECGs like this, the job of the medical technician is just to inform the physician. It is not the job of the medical physician, medical assistant, or ECG technician, or any other one, even nurse, that they should diagnose on the ECG. But they should at least familiar with the important ECGs like ventricular fibrillation, ventricular flutter, and ventricular tachycardia. This is tachycardia, flutter, tachycardia, flutter, and fibrillation. They should be at least familiar with these plus myocardial infarction. This is taken as their extra qualification. So if you count here, the heart rate will be in between 400 to 600, somewhere 400, somewhere 500, somewhere 600, and P wave is absent. QR is also non-existent. Rhythm is irregular. This is known as VFib. Ventricular fibrillation is abbreviated as VFib, a sign of danger. Then there are two other ECGs on the bottom with red color. The first one is known as agonal heart. In agonal heart, this is a sign of failing heart. The heart is beating very slow, very weakly, but and after a long time. So you will see small complexes after long interval. This is known as agonal heart. Agonal means failing heart. Immediately the basic life support should be started like CPR and an electric shock. Then the last one, ECG is a straight line. It is known as asystole. Asystole means there is no polarization, there is no contraction of the heart. No electrical change, no mechanical change. Heart is not contracting, it has stopped contracting. So this may be a beginning of cardiac arrest, or this may be a sign of death. Patient heart has stopped functioning. So just remember a few characteristics of different ECGs and their shapes, and this is all what is expected from a medical assistant and other paramedics. So this was a short discussion about ventricular arrhythmias, ventricular tachycardia, ventricular flutter, and ventricular fibrillation. I thank you very much. Have a good day.